Alright, welcome back for Lab 6, talking about the muscles of the hip and knee this week. So there's 23 slides. At least one of those is a double, and then for some of those muscles, specifically for the external rotator group, you don't need to know origin and insertion. So I'll touch on them briefly, but that's not something that you need to know. And to help re-emphasize that, if you download the slideshow in Canvas, you won't see the origin or insertion for any of the Deep 6 external rotator group. So, without further ado, let's get into the muscles. And again, I'm following along with the PowerPoint that's up in Canvas. So I'm following that exact order and just showing you where each of those muscles are on the Essential Anatomy app. So you can see that my first muscle there is iliacus. And I keep talking about them as iliopsoas because functionally they are basically one muscle, but there is some difference between the two. So iliacus, you can see there, originates in the iliac fossa, and then part of it goes up onto the iliac crest, and then depending on which textbook you look at, so our textbook lists the lateral sacrum, but you can see from the Essential Anatomy app, it doesn't really look like it goes onto the sacrum. So just for ease, we'll say that it originates from the iliac fossa. And then it's going to insert onto the lesser trochanter. And so along with psoas, iliacus is going to be a hip flexor, so acetabulo-femoral flexion, and adduction, and external rotation, because it basically runs straight up and down there to the medial aspect of the hip. And so when that muscle shortens, not only is it going to produce flexion or adduction, but it'll produce some fairly slight external rotation as well. So we'll move from there to our psoas muscle. Maybe. There we go. So there's our psoas muscle. And so you can see psoas originates from the transverse processes of T12 through L5. And again, it's going to run together with iliacus, and both of them insert onto the lesser trochanter of the femur. So just like iliacus, psoas is going to be a hip flexor, so acetabulo-femoral flexor, adductor external rotator. So if I were to ask you which muscle inserts at the lesser trochanter, you could say iliacus, or psoas, or iliopsoas. All three of those answers would be correct, provided you know the action is, again, the primary action is going to be flexion at the acetabulo-femoral joint. So then the next muscle, we're going to move down just a little bit. There, you can see it. So we're going to move inferiorly and medially, and that's our pectineus muscle. So the pectineus is one of your deeper hip flexors, because you can't tell yet, but we've already peeled off a few layers of muscle, or at least you probably would have guessed that. We've peeled off the quadriceps group, so you can see pectineus in there. So pectineus originates from the pectineal line of the pubis. It inserts just inferior to the lesser trochanter on the linea aspera there, so the medial aspect of the linea aspera. And just like iliopsoas, pectineus is a flexor and an adductor at the acetabulo-femoral or AF joint. Then we'll move on to our quadriceps group. So the thing to know about the quad group is that it originates from, or it is on the anterior aspect of the thigh. So it's the big group of muscles there on the front of the thigh. As you would expect from the name quadriceps, there are 4 of them. Only one of those 4 actually crosses the acetabulo-femoral or hip joint, and that one is rectus femoris. So the important thing to know is of the 4 quad muscles, rectus femoris is the only one that crosses the hip, and at the hip, it is a flexor. So in terms of the origin insertion stuff, so rectus femoris originates at the anterior inferior iliac spine, or AIIS, and then inserts into the tibial tuberosity. So the patellar ligament is not on there. So patellar tendon, patellar ligament are used pretty interchangeably. Depends on the anatomy textbook that you look at. So people talk about the patellar tendon reflex. So when you go to the doctor's office and they use the little rubber hammer and they hit you just below your knee, that's your patellar tendon, but some books will talk about it as the patellar ligament because, and you can see where I'm mousing over, it runs from the tibial tuberosity, again this really prominent area on the front of the tibia where people get Osgood Schlatters, to the apex of the patella. So that's one part of it. So since it runs bone to bone, sometimes people talk about that as the patellar ligament. And then this area up here is sometimes referred to as the patellar tendon, or collectively the whole thing. Oftentimes people will talk about being the patellar tendon. But nonetheless, rectus femoris runs around and over the patella and then inserts via the patellar tendon or ligament into the tibial tuberosity down here. So its actions include acetabulo-femoral flexion, so hip flexion, but also tibiofemoral, which is the knee, extension. So it's a biarticular muscle, crosses both joints. Then originating just superior to rectus femoris is our sartorius muscle. So sartorius originates at the anterior superior iliac spine, or ASIS, and it's going to run down to the medial aspect of the tibia to an area called the pes anserine. So sartorius is actually going to do quite a few things. So at the acetabulofemoral joint, sartorius is going to be a flexor, an abductor, and an external rotator. And then sartorius is actually also active at the tibiofemoral joint, so at the knee, where it's a flexor and an internal rotator. So sartorius has 5 different actions, 3 at the hip and 2 at the knee. And the easiest way to think about what it is that sartorius does is to, if you're seated, take one leg and cross it over the other. And so when you do that, when you cross your, let's say your right ankle over your left knee as you're seated, you'll do all of the actions that it does. You'll do hip flexion, abduction, external rotation, and then knee flexion as well. The only thing you may not do is internal rotation at the tibiofemoral joint or at the knee. So you're going to get at least 4 of the 5 actions whenever you do that. So that's sartorius. Interesting things about it: longest muscle in the body. We talked about it as one where the muscle cells or muscle fibers run from one tendon to the other, so it has really long muscle cells. The other thing is that there are 2 other muscles that insert here at the pes anserine. So it's Sartorius Gracilis, which we'll talk about in a minute, it's one of the groin muscles, and then semitendinosus, which is this one most posteriorly back here. So semitendinosus is one of your hamstring muscles. So 3 muscles that we talk about are going to insert here at the pes anserine, which again is basically just the medial aspect of the tibia, medial to the tibial tuberosity. And I'll show you how to find that on the tibias when we get to class. So then we're going to move from the anterior and medial aspect of the thigh out to the lateral aspect to tensor fascia lata, or TFL. I haven't actually used the little speaker icon to see how the anatomy app says it. It'd be interesting to do, but I call it tensor fascia lata. That's how I've always heard it, but typically people just abbreviate it and say TFL. So you can see the origin of TFL up here just posterior to the ASIS. So this is your sartorius right here, and then obviously TFL is in the yellow, so just posterior to the ASIS and then along the iliac crest. And then it is going to insert into something called the iliotibial band, or IT tract, or iliotibial tract. So IT band, IT tract, people use those pretty interchangeably. And what that is this big band of fascia, or connective tissue, that's on the lateral aspect of your thigh. So there's 2 muscles that run into the IT band, the first being TFL, and the other one being Gluteus Maximus. So the IT band is a tendon of insertion for both of those muscles. The IT band is a structure that tends to cause pain at the hip or pain at the knee, particularly if either of those 2 muscles are stiff or short. So if TFL is stiff or short, or if Gluteus Maximus is stiff or short, they'll pull the IT band tight up here across the greater trochanter, and it'll click back and forth when they flex the hip or when they squat. So usually people will report problems getting into or out of the car or going up and down stairs. Sometimes they'll report a click or a shift on the outside of their hip. And so that's typically the IT band. And again, usually it's related to stiffness or shortness of either TFL or Gluteus Maximus or both. The other place that the IT band can cause some problems is down here on the lateral aspect of the knee. It can click back and forth across the lateral condyle of the femur, the lateral epicondyle of the femur, and so then that can cause some pain on the lateral aspect of the knee as it shifts forward and backward as you flex and extend the knee. So that's TFL. In terms of its actions, it's a flexor, an abductor, and an internal rotator or medial rotator at the acetabulofemoral joint. All right, so now we're going to move to the posterior view. So now we're into the hamstring group. So there's 3 muscles in the hamstring group, and the way I laid them out is from medial to lateral. Although you'll notice, so when I say medial, semimembranosus is the most medial of the 3, but you'll also notice that it's deep to semitendinosus. So what I'm mousing over right here is semitendinosus, and then semimembranosus is underneath that, or deep to that. But technically it's also the most medial of the 3. So this is our semimembranosus muscle. Remember that all 3 of the hamstring muscles originate from the ischial tuberosity. And then they'll have different points of insertion, but their point of origin is the same. So the semimembranosus originates from the ischial tuberosity and inserts on the posteromedial, so back along the midline, condyle of the tibia. So it is both a flexor at the knee, so tibiofemoral flexor, and an internal rotator. At the hip, so at the acetabulo-femoral joint, all three of the hamstring muscles do the same thing. So at the hip, they are all hip extensors. They play a role in helping you push off. And most specifically, when you're taking shorter strides, so oftentimes when you're walking or if you're doing like a slow jog, your hamstring muscles are much more involved in that. The farther down you go into hip flexion, so as you squat deeper, as you run faster, so when you sprint, things like that, that's when you're going to engage glute max more and your hamstrings a little bit less. But those shorter strides are typically where we see the hamstrings more involved. So there's your semimembranosus. Next one is our semitendinosus. Again, it is superficial to semimembranosus. So again, the origin is the same, so it originates from the ischial tuberosity, and in this case inserts on the medial aspect of the upper tibial shaft is the way that it's worded in the slideshow, but it inserts at the pes anserine, and you'll see that in parentheses. So semitendinosus inserts along the pes anserine, again, posterior to the sartorius, and the gracilis actually. So semitendinosus, just like semimembranosus, is an extensor at the acetabulofemoral joint, and then a flexor and internal rotator at the tibiofemoral joint. Then if we move to the lateral aspect, so you have two medial hamstring muscles and one lateral. So semimembranosus, semitendinosus are medial, and then biceps femoris is lateral. So biceps femoris also originates from the ischial tuberosity, and it's going to insert into the head of the fibula. You'll see on this slideshow, if you're looking closely, that it says long head there, that biceps femoris does have a short head that originates from the lateral lip of the linea aspera. So both of those two heads, though, run together and insert onto the fibula, so the insertion point is essentially the same. So biceps femoris, the important thing I want you to know is actually the long head. So it originates there, again, ischial tuberosity, inserts into the head of the fibula, extensor, acetabulofemoral, flexor, tibiofemoral, and then it's also an external rotator at the tibiofemoral joint. So it's a lateral rotator at the knee. Then we're going to move on to glute max. So glute max is your big superficial butt muscle. So you can see there, fairly large muscle, which means it has a fairly large origin that runs along the posterior aspect of the ilium, so way back here along the iliac crest, but then also onto the sacrum, which again, so the sacrum is the bone between either of the innominate bones, and then onto the coccyx down here, which is your tailbone. So it actually crosses then three bones for its origin, so the ilium, the sacrum, and the coccyx. And then it runs into, as you can see here, the iliotibial band. So that's one way that it inserts into the tibia in that case. But also part of it inserts, you can see down here, into the gluteal tuberosity. And the gluteal tuberosity is essentially just inferior and lateral to the lesser trochanter. So it's going to insert just a little bit below the iliacus and psoas muscles. So the primary action of gluteus maximus is going to be extension at the acetabulofemoral joint. So it's your biggest, most powerful hip extensor. And again, it's more active the farther you go into a squat. So in higher degrees of hip flexion, it becomes more active, but also as you're pushing off more, gluteus maximus becomes more involved. And then the other thing is that the superior fibers, so the ones up here, are abductors at the acetabulofemoral joint. And then the inferior fibers down here are adductors. So it is, again, one of those relatively unique muscles that does antagonistic or opposite actions in that it is both an abductor and an adductor at the same joint. So that's gluteus maximus. Then on to the deep six. So these are all together on one slide if you look at the slideshow in Canvas. So for the next six muscles, you don't have to know the origin or the insertion. They all insert somewhere into the greater trochanter, and then their origin is some combination of, so for example, piriformis, it originates on the sacrum, but then as we get into muscles like superior gemellus, you're going to see that it's going to originate here from the ischial spine. So they kind of run along some combination of the sacrum, the obturator foramen, or along the ischium. But at any rate, so going back one to piriformis, so piriformis is the order that I'm going to go in is from superior to inferior. So top to bottom is the order that they're going to go in. So you can see your piriformis there. One thing that's not on this view is your sciatic nerve. So your sciatic nerve is the nerve that innervates your posterior aspect of your thigh, so it would be right here, and it actually runs underneath the piriformis. So all of these next 6 muscles are external rotators, so a way to think about them is analogous to the infraspinatus muscle and teres minor muscles that we talked about in the shoulder. So those are also external rotators that in that case insert onto the greater tubercle. So in this case, all the external rotators insert onto the greater trochanter. So piriformis, if it's tight, it can actually press on the sciatic nerve and cause tingling and numbness down the back side of the leg, which can sometimes be mistaken for a low back issue, but is really an issue of stiffness or shortness of this particular muscle. So then we move from piriformis inferiorly, and we get to the superior gemellus. So superior gemellus, again, is going to be an external rotator. Again, you don't have to know this part, but it originates from the ischial spine and then inserts onto the greater trochanter. Its action is external rotation, acetabulo-femoral. Then we get to our obturator internus. So as you would imagine, it originates from the internal aspect of the obturator foramen. As I mentioned last week, that hole in the innominate bone is actually covered with fascia or connective tissue. And so the obturator internus originates from there, and you can see it has a fairly long tendon that shoots just above the ischial tuberosity, so you can see the hamstring muscles down here. So just superior to the ischial tuberosity, and then inserts on the greater trochanter, also an external rotator. And then we can move down to the inferior gemellus. So originating from essentially that lateral aspect of the ischium into the greater trochanter, external rotation. And then we have our quadratus femoris, again, lateral aspect of the ischium, and then greater trochanter, external rotator. And then our last one, which is not pictured in the slideshow because we have to go to an anterior view to find it, but it's right there. So that's our obturator externus. And so you can see it originates from that external aspect of the obturator foramen, also inserts onto the greater trochanter. So all 6 of those muscles, starting with piriformis on down to obturator externus, their primary action is external or lateral rotation, acetabulo-femoral joint. So all of those are deep to glute max, and all of them, actually not all of them, obturator externus is not on the plastic leg, but the top 5 of them are, and so you have to take off gluteus maximus, and you'll be able to find them, and they're in the order that I just went through them. So piriformis on down to quadratus femoris are all on there in order on the plastic leg, and you'll be able to find them this week. Then we'll move on to our adductor group. So again, the adductors are synonymous, mean the same thing as groin muscles. So we're going to talk about 3 of them. There is another one that we won't get to, which is Adductor Minimus, but the 3 primaries are your Adductor Magnus, Longus, and Brevis. So MLB, or Major League Baseball, similar acronym, right? If that helps you remember. So Magnus, Longus, and Brevis, and we'll start with Adductor Longus here. So all of them are going to originate somewhere on that anterior and inferior aspect of the innominate bone. So specifically for Adductor Longus, the origin is on the pubis, near the pubic symphysis, and it'll insert, or it does insert, on the linea aspera. So for Adductor Longus, the 2 actions are adduction and flexion at the acetabulo-femoral joint. So it's a flexor because essentially it runs from the anterior aspect of the pubis to the posterior aspect of the femur. So in addition to being an adductor, it is also a flexor at the acetabulo-femoral joint. Then we have our Adductor Brevis. So one of the things for Adductor Brevis is that you can tell, if I back up a slide, we had to take off Adductor Longus and pectineus. So you got to remove enough muscle layers to be able to find it. So Adductor Brevis, the origin is the body and inferior ramus of the pubis, also inserts on the linea aspera, but it is proximal to the Adductor Longus. That's what makes it brevis, or a shorter muscle, because its insertion is higher up, so more proximal than we see with Adductor Longus. And since it doesn't run quite as far anterior to posterior, it is neither a flexor nor an extensor. It is only an adductor. So the action then for Adductor Brevis is adduction. And then Adductor Magnus, so Magnus means the great one, so it's the largest of the adductor muscles. So because it's the largest, it has a really large origin and then a fairly large insertion area. So the origin is both the ischial and pubic rami, so rami is plural, you don't say ramuses. So the ischial and pubic rami, and then onto the pubic tuberosity. So all of those origins basically is kind of that whole inferior aspect of the innominate bone. So all of that runs together and inserts into the linea aspera, essentially the length of the linea aspera, and then into the adductor tubercle. So on this anterior view, you can see the insertion into the adductor tubercle down here, but then if we look at it from the posterior view, you can see how big it is. So again, its insertion is going to run essentially the length of the linea aspera. And then this is the one you don't need to know. This is Adductor Minimus up here. So all of this then is Magnus. So because Magnus has such a large origin, again, covering most of that inferior aspect of the innominate bone, and such a large insertion, it does a few things. So it is obviously an adductor. But in addition to that, the more anterior fibers are going to be flexors at the acetabulo-femoral joint, and then the posterior fibers are going to be extensors at the acetabulo-femoral joint. So Adductor Magnus, it serves a fairly important role in hip extension. So it's one of the ones where you'll see sometimes when people are fairly novice at the squat exercise, one of the things that they'll do is when they get to the bottom, as they start to come back up toward the top, when they go to stand up, their knees will buckle medially. And one of the reasons that they're doing that is because they're trying to engage Adductor Magnus to help them extend the hips. And so as they engage Adductor Magnus, then they get adduction as well as hip extension. So that's why you see, again, more novice lifters bring their knees in when they first start to come up from the bottom of a squat, is because of engagement of Adductor Magnus and not full stabilization using the abductors, so Gluteus Medius and Minimus specifically. All right, then we got our Gracilis. So Gracilis, again, one of the adductors, or because GR sounds like groin, right? So Gracilis is the last of the adductor muscles we'll talk about. So the origin for Gracilis is the inferior ramus and body of the pubis. And then the insertion, again, as I mentioned earlier, is into the pes anserine, so the medial aspect of the tibia. Again, as you can see there, just medial to the tibial tuberosity. So Gracilis is going to be involved in adduction and then flexion. So adduction and flexion is the longest of the adductor muscles, and it'll be pretty obvious when we get to the plastic model this week. It's one of the easier ones to find because it's the most medial of them as well. All right, and then two more. So these last two are the other two glute muscles, and they are both abductors and internal rotators at the acetabulo-femoral joint. So first, we've got our Gluteus Medius. So last time we talked about the gluteal lines. Remember that there's a posterior, an anterior, and an inferior gluteal lines, and those correspond to the glutes. So in the case of Gluteus Medius, it's going to originate between the posterior and anterior gluteal lines, and then as I mentioned, it'll insert into the greater trochanter of the femur. So its action is abduction and internal or medial rotation. So abduction and internal and medial rotation. And then if we go underneath or deep to glute medius, we'll find our glute minimus right there. So again, we're going to get the gluteal lines involved. So gluteus minimus is between the anterior and inferior gluteal lines, and then also inserts into the greater trochanter of the femur. So also an abductor and an internal rotator. One of the really important roles about both of those two as abductors, and then the more superior fibers of Gluteus Maximus as an abductor, is they're really important pelvic stabilizers. So if those three muscles aren't strong enough or you don't use them effectively, as you take a step, so let's say I'm swinging my left leg during a stride, that leg is the non-weight-bearing leg. If the glutes on the right side aren't strong enough, you're going to get what's called pelvic drop, and the left side of the pelvis will fall down, it'll drop. And so that'll stretch out your right IT band. That can cause low back pain. That can cause dragging of the IT band on the greater trochanter. It can cause lateral knee pain. There's a bunch of stuff that can go on that's problematic if those abductor muscles are tight. Not tight. If those abductor muscles are weak. So if Gluteus Medius and Gluteus Minimus are weak, then that tends to cause problems in terms of lack of pelvic stability, and that can cause, again, problems from the knee up through the lower back. So that's all the muscles for this week. So we'll find all those in class, and then we'll only have one more slideshow where we'll talk about muscles. So we'll see you in lab on Thursday.